What if I told you that your blood pressure could be quietly killing you and you wouldn't even know it until it's too late? For older adults, high blood pressure isn't just a concern, it's a ticking time bomb, threatening strokes, heart attacks, and kidney failure. But here's the question. What's the real ideal blood pressure for seniors? Should we chase the same numbers that work for younger adults, or is there a more dangerous risk to aiming too low? In this video, we'll dive into the hidden dangers of aging and blood pressure, uncover the science behind it, and discover how you can manage hypertension to protect both your health and your life in your later years. Stay tuned, because understanding this could be the difference between thriving and simply surviving. The physiological changes and their impact on blood pressure in older adults. As we age, our bodies undergo significant physiological changes that affect blood pressure regulation. One of the most notable changes is the gradual stiffening of arteries, which leads to increased vascular resistance. As a result, the heart works harder to pump blood, causing systolic blood pressure to rise. This arterial stiffness is further compounded by hormonal changes, particularly a decrease in the production of renin, a hormone that helps regulate blood pressure. As renin production declines, the body struggles to balance blood volume and vascular tone, making it harder to maintain normal blood pressure levels. In addition, the kidneys, which play a crucial role in regulating blood pressure by filtering fluids and balancing sodium, become less efficient with age. This results in the accumulation of excess sodium and water in the body, further raising blood pressure. These age-related changes are often exacerbated by the presence of comorbid conditions such as diabetes, obesity, and cardiovascular disease, making blood pressure management even more complex. The combination of these factors underscores the need for a more individualized approach to managing hypertension in older adults. Hypertension in the elderly is not simply about achieving ideal numbers. It is the result of a complex interplay of vascular, hormonal, and renal changes. Given this complexity, a personalized treatment approach, rather than a one-size-fits-all model, is essential for managing blood pressure safely and effectively in older adults. Determining the ideal blood pressure for seniors. A complex equation. For decades, the ideal blood pressure has been widely accepted as 120/80 mmHg, a standard that has been at the core of cardiovascular health recommendations for the general adult population. This benchmark, long regarded as the gold standard for optimal heart health, has shaped the way we approach blood pressure management. However, as we consider the unique physiology of older adults, one must ask, does this same target hold true when the body undergoes profound changes with age? Recent advancements in clinical research and the evolving body of guidelines now suggest that the widely accepted norm for blood pressure management may not be entirely appropriate for seniors. Specifically, the rigid pursuit of blood pressure values as low as 120/80 may, in fact, pose risks for older adults, especially those who are frail or managing multiple chronic conditions. The aggressive treatment of blood pressure to meet this target, while seemingly beneficial in the short term, can sometimes create more harm than good. For frail individuals or those with advanced comorbidities, such an aggressive approach can lead to a range of complications, from dizziness and fainting to kidney dysfunction and electrolyte imbalances. These risks often outweigh the potential benefits of pushing for excessively low blood pressure levels. This shift in thinking challenges the notion of a one-size-fits-all approach to blood pressure management. Rather than adhering to a universal target, the treatment of hypertension in older adults requires a more sophisticated, individualized strategy. One that considers not only the patient's current blood pressure readings but also their overall health, medical history, and potential risks associated with aggressive pharmaceutical interventions. Age, frailty, and the presence of additional health conditions must all be factored into the equation, as these variables greatly influence the effectiveness and safety of blood pressure management strategies. What becomes increasingly clear is that managing blood pressure in the elderly is not simply about achieving an ideal number. It is about understanding the complexities of the aging body, weighing the risks and benefits of treatment, and personalizing the approach to best serve each individual. In this context, treating high blood pressure with a nuanced, patient-centered approach becomes paramount, ensuring not only the safety of the individual but also a continued quality of life. Revised guidelines, shifting the goalposts. In 2017, the American College of Cardiology, ACC, and the American Heart Association, AHA, revised their blood pressure guidelines, lowering the threshold for diagnosing hypertension to 130/80 mmHg point. This change was based on evidence suggesting that more rigorous blood pressure control could reduce the risk of severe cardiovascular events like heart attacks, strokes, and heart failure. While this revision offers better protection, it has sparked concerns about the potential for overtreatment, particularly in older adults. A key issue in these updated guidelines is the push for systolic blood pressure to drop below 120 millimeters of mercury. Studies, including the 2015 SPRINT study, showed that such aggressive treatment can reduce heart attacks and strokes. However, these benefits come with risks. The SPRINT study found that the intensive treatment group experienced an increased incidence of adverse effects, including hypotension, dangerously low blood pressure, electrolyte imbalances, kidney dysfunction, and a decline in quality of life. Symptoms like dizziness, fatigue, and frequent falls became problematic for many participants. This raises an important question. Is it appropriate to pursue such low blood pressure targets for all elderly individuals? For frail seniors or those with multiple health conditions, the risks may outweigh the benefits. Excessively low blood pressure can increase the likelihood of falls, kidney complications, and diminish overall quality of life. While the revised guidelines offer hope for some, they also highlight the need for a more personalized approach to blood pressure management in older adults. Healthcare providers must consider not only the numbers, but also the unique health factors of each patient to avoid overtreatment and ensure the best outcomes for each individual's health and well-being. The dangers of overtreatment, a cautionary tale. Controlling blood pressure is crucial for reducing the risk of life-threatening conditions like strokes, heart failure, and kidney damage. However, aggressively lowering blood pressure, especially in older adults, can have serious unintended consequences. The SPRINT study, although showing the benefits of more intensive blood pressure control, also highlighted the risks of targeting excessively low levels, particularly in the elderly. Older adults are especially vulnerable to the side effects of aggressive blood pressure management. As the body ages, its ability to tolerate such treatment decreases, and what may appear as a harmless reduction in blood pressure can lead to harmful effects, such as hypotension. A significant drop in blood pressure can cause dizziness, fainting, and blurred vision, increasing the risk of falls. Falls in older adults can result in serious injuries, impacting their independence and quality of life. Kidney dysfunction. When blood pressure is reduced too aggressively, especially in those with existing kidney issues, it can worsen kidney function, leading to acute or chronic renal failure, a potentially irreversible condition. Electrolyte imbalance. Blood pressure medications, particularly diuretics, can disrupt electrolyte balance, causing severe effects like cardiac arrhythmias, muscle cramps, and fatigue, which are particularly risky for older adults. Reduced quality of life. The side effects of intensive blood pressure treatment, such as extreme fatigue and dizziness, can interfere with daily activities and diminish independence, leading to increased reliance on caregivers. Given these risks, it is clear that the pursuit of ideal blood pressure numbers must be carefully balanced, especially in seniors. A personalized, nuanced approach to blood pressure treatment, tailored to each individual's health profile, is essential to minimize harm and ensure both longevity and quality of life. Personalizing blood pressure treatment, the cornerstone of safe management. Effective blood pressure management in older adults relies on a personalized treatment approach. A one-size-fits-all strategy does not work for seniors, as their health profiles, medical histories, and risk factors vary widely. Healthcare providers must tailor blood pressure targets to each individual, considering their unique health challenges. For frail seniors or those with multiple chronic conditions, a more conservative approach is often best. A systolic blood pressure target between 140 to 150 millimeters of mercury is more appropriate for many. Balancing cardiovascular risk reduction with a lower risk of harmful side effects like dizziness, fainting, falls, and kidney damage, which are more common when blood pressure is lowered too aggressively. For healthier seniors with fewer chronic conditions, a more aggressive approach may offer additional benefits. However, this must be done with great caution, closely monitoring blood pressure and adjusting medications as needed to avoid adverse effects. Regular monitoring is essential, as seniors are more susceptible to changes in health, and even minor fluctuations in blood pressure can have significant consequences. Ultimately, the key to safe and effective blood pressure management in older adults is a personalized approach that considers overall health, comorbidities, and specific risks. By tailoring treatment plans, healthcare providers can reduce the risk of cardiovascular events while preserving the patient's quality of life, promoting healthier, longer lives for seniors. The role of lifestyle changes in managing blood pressure. Pharmacologic treatment is vital in managing hypertension in older adults, but lifestyle modifications are equally important. A comprehensive approach should include not just medication, but also essential lifestyle changes that support overall health and reduce dependence on medications. Regular physical activity, a balanced diet, and stress management are key factors in maintaining healthy blood pressure. Exercise. Regular physical activity, such as walking, swimming, or light aerobics, strengthens the heart, improves circulation, and enhances blood vessel health. These benefits help regulate blood pressure and improve cardiovascular health. Simple activities like daily walks or stretching exercises can have a lasting impact when done consistently. Diet. A nutrient-rich diet is crucial in managing blood pressure. Eating a variety of fruits, vegetables, whole grains, and lean proteins supports heart health. Reducing sodium intake is especially important to prevent water retention and elevate blood pressure. A diet rich in potassium, magnesium, and fiber helps balance sodium levels and supports fluid regulation. Stress management. Chronic stress is a major contributor to high blood pressure. Seniors, who may already be managing other health issues, can benefit from stress-reducing practices like mindfulness, meditation, and deep breathing exercises. These techniques help lower cortisol levels, improve heart rate, and reduce blood pressure. In summary, while medication is an essential component of hypertension management, lifestyle changes offer powerful, natural alternatives. Through regular exercise, a heart-healthy diet, and stress management, seniors can reduce their reliance on medication and improve their quality of life, leading to longer, healthier years. Conclusion. The imperative of balance and individualized care. Managing blood pressure in older adults is not a one-size-fits-all equation. It requires a nuanced, thoughtful approach that recognizes the delicate balance between reducing hypertension and preserving overall well-being. While it is undeniably important to control blood pressure to prevent life-threatening conditions such as strokes and heart attacks, the pursuit of excessively low targets can have unintended and serious consequences. Falls, kidney damage, and an overall decline in the quality of life. For those living with hypertension or at risk, the goal should never be merely to chase perfect numbers on a blood pressure cuff. Instead, the focus should be on a treatment plan that is not only safe but effective, carefully tailored to each individual's unique health profile. It's crucial to remember that no two people are the same, and your treatment plan must be as unique as your body. By working closely with healthcare providers who take the time to understand your personal health history, current condition, and potential risks, you can find a path to managing your blood pressure that minimizes harm and maximizes your quality of life. Don't let blood pressure management become another stressor. Empower yourself with the knowledge and tools to make informed, balanced decisions. Whether you're already dealing with hypertension or are at risk, remember, the key to a healthier, longer life lies not just in the numbers, but in the thoughtful care and attention to what truly matters: your health and your well-being. Through personalized care, regular monitoring, and appropriate lifestyle changes, older adults can enjoy a longer, healthier life, free from the burdens of excessive medication and the risks of uncontrolled hypertension. If you found this information helpful, don't forget to like, share, and subscribe for more valuable insights on managing your health. And, as always, we'd love to hear your thoughts. Leave a comment below and let us know how you're managing your blood pressure.